So we're going to start with the supraspinatus, which is the most commonly affected rotator cuff muscle. Supraspinatus is an AB ductor. So if I can get Sam just to turn and face me this way, so if I get him to put his arms out into the scapular plane, so if I can get you to put your arms out forwards, then to point the thumbs down. This is sometimes called the empty can sign in America, or Job's test. What I'm going to do is I'm going to push down against Sam's arms and he's going to resist me and push up against me. So what I'm really looking for is if he was to have any pain or discomfort, that would be an indication that he had some supraspinatus pathology. And obviously he had any asymmetric weakness, or his arm drops down, that would be an indication there'd be some weakness there. So that's looking at supraspinatus. Next thing to look at is infraspinatus and teres minor, which are external rotators. So Sam, if I can get you just to put your arms up in this position, this is really resisted external rotation. So once again, I'm going to push in and Sam's going to push out against me. I'm looking for pain or any obvious weakness. The last muscle is subscapularis, that's the internal rotator. The body is in the way for that, so there are a number of special tests that we do. The first one is Gerber's lift-off test. So Sam, if I can get you just to turn sideways like this, just bring your hand onto your bottom. And what I'm going to do, I want you to push your hand away from your bottom against my hand. So you can see Sam's pushing away. This is actually a negative test because subscapularis is working, he's internally rotating. A positive test would where he couldn't lift his hand off. In some patients, they have a lack of range of motion. They actually find it quite difficult to get the hand round to behind their bottom. So another test is called Napoleon's test. So Sam, if I get you to put your hand onto your tummy like this, what I want you to do is I want you to push your hand into your tummy and I'm going to pull your hand forward. So this is internal rotation that does this. If the internal rotators aren't working, a trick manoeuvre is to extend your arm. So Sam, if your arm was to collapse in like so, by pulling the arm back, you can actually pull the hand in. So it's important when you're doing Napoleon's test that the patient has their arm nice and forward and not pulling back against you. The last one, which perhaps is a slightly cruder test, is called the bear hug test. So I can get you to bring your arm across your body as you're trying to hug onto yourself. I'm going to try and pull your hand away. So by pulling away, if they've got weak subscapularis, the arm may pull off. So the impingement sign, what I'm going to do is I'm going to push down on Sam's acromion to try and decrease that space. I'm then going to lift his arm up into abduction in the forward scapular plane. And if he were to have a positive impingement sign, he'd experience pain and discomfort in doing this. A more reliable test, I find personally, is to use the Hawkins impingement sign. And what I do is I'm going to bring Sam's arm up to about 90 degrees. And as I internally rotate his arm, the greater tuberosity is going to move underneath the acromion. And if he experiences pain in doing this, that's a positive impingement sign. What I'm going to do is I'm just going to bring Sam's arm across his body as far as I can and load it. So really we're having axial compression on the AC joint. So if he does have any pathology, he'd experience some pain and discomfort in doing this. The first thing I need to do is once again identify the long head of biceps. So I find the lesser tuberosity, then I just press slightly lateral to that and I'm onto the long head of biceps. I'm going to take Sam's hand. What I'm going to do is I want you to turn out as I turn in. Off we go. Resisted supination. I'm pressing on the long head of biceps. If he's getting any pain or discomfort, there's some indication there's some pathology there. The other movement is flexion, so I get Sam to turn his hand so it's pointing up to the ceiling. I'm going to press down now, you resist me and push up. And once again, if he experiences some pain and discomfort, that's an indication that he may have some long head of biceps pathology. Thank you for watching this video. This is my way of examining the shoulder, but I appreciate there are many different ways to do it and many different tests that you can do. However, at the end of the day, we're trying to make a diagnosis. You can't do that from an isolated examination. It's important to take into account the history, examination, the special tests, and also investigations. I hope this video has been of help to you.